As COVID-19 pandemic that shook the world in the year 2020 now enter its fourth year, WHO reports that despite the effort, millions continue to be infected or reinfected with SARS-CoV-2. With its devastating effects, reducing and controlling this infection, specifically in the vulnerable population, becomes a top priority. Who are these vulnerable individuals and which are the population that are likely to become vulnerable are the two most important questions that need to be answered. In today's world where work has become the top priority for most of us and the pressure to meet strict timelines is increasing by the day, we often tend to ignore the most important part of our lives, our health. The individuals with compromised health are the ones that were mostly targeted in COVID-19 tragedy. And the individuals who were targeted are developing post-COVID complication down the lane. For decades, scientific community has proved that autoimmune conditions are likely to develop in case of viral infection. COVID-19 infection elicits a prolonged inflammatory response that triggers the immune system to produce antibodies against viruses, and sometimes these antibodies target foreign as well as self molecule causing autoimmunity. Since your immune system is the first to be compromised on an attack of a viral pathogen, the individual becomes susceptible to the development of autoimmune disease. Systemic lupus erythematosus, rheumatoid arthritis, and systemic sclerosis are some of the autoimmune diseases that have been identified linked to COVID-19 complications. Rheumatoid arthritis is one such condition. With prolonged inflammation as the common symptom of COVID-19 and rheumatoid arthritis, this arthritis condition is causing real trouble to many individuals with inflamed joints. Rheumatoid arthritis develops when cells of the body undergo an autoimmune response. Cells of your body produce antibody not only against foreign pathogens such as SARS-CoV-2 virus but also against the own cells of your body. Sheetal Ramani, a professional working in biotech company, was hit hard by this disease as early as the age of 18.
Hey, this is Sheetal Ramani. I'm currently working as a senior research associate at Syngene International Limited. So I was diagnosed with rheumatoid arthritis around a decade ago in 2012 when I was 16 years old. So when I got the diagnosis, my life shattered because of the incurability of the disease, and there was no one in my family or my family friends who was suffering from this disease. So I had no reference point. But I started my medications that year, and the years after my diagnosis, like 3-4 years, it was bad. It was really bad. My actual symptoms were I had so I had my fingers swollen, tender, my wrist movements reduced. They were very swollen, they were tender. I had pain in my wrist, my elbows, my knees, even my ankles, and sometimes it also hurt my jaw and my back. So it was very difficult in those early years. I actually got some deformations because of the severity of those diseases in my wrist, in my elbows, which are irreversible. But I had to go on with my life. In 2012, I had just started my graduation, and it was very difficult for me to attend the classes, go to my classes, because most of the days I had swollen ankles, swollen knees, and it was difficult for me to do the day-to-day works also, like opening a jar or carrying my bag. But I I endured through everything. Because of the medication, the heavy medications, my doctor put me on several medicines like hydroxychloroquine, corticosteroids, methotrexate, sulfasalazine, along with painkillers. So it was a whole regime. But because of those medicines and my disease, the progressiveness of my disease, my appetite had gone, and I had developed gastritis also, and kidney stones also. And I'm 5'6". My height is 5'6", but at that time I used to weigh around 42, 45 for till I think 2015, 2016. So it was very difficult for me.
So we
But
come to know that what are the difficulties the patient face in dealing with the disease. Dr. Sahil Batra is an orthopedic surgeon from All India Institute of Medical Sciences who are dealing with this such population of rheumatoid arthritis since many years. We asked some detailed analysis from him regarding the disease. Let's see what he has to say. How a patient suffering from rheumatoid arthritis can identify its symptoms from normal joint pain.
So a normal patient with a joint pain could have a rheumatoid arthritis or osteoarthritis. So a rheumatoid arthritis usually present early, and usually they present with small joint pain, and usually they are symmetric, and with time it progresses to proximal joints. Suppose it starts with small joint, it progresses to the bigger joints in the body, and they have early onset as compared to the other patients. We find a very common peculiar finding. Sometimes a patient comes with pain in the knee joint, says, "Sir, I have arthritis. Could it be rheumatoid arthritis?" Which is very unlikely. Why? Because that joint pain could also be due to increased uric acid. So, a symmetric joint pain involving the small joint could be very easily diagnosed. Still, it could be rheumatoid, but very unlikely.
What are the challenges faced by clinicians to identify rheumatoid arthritis patients, and how do they distinguish other joint disorders such as osteoarthritis from rheumatoid arthritis?
So as I have already mentioned, RA patients are more of a younger age group which we get. We usually get the patient as an orthopedician in a burnt out disease. It is very rare to us to get the patient in early disease. If we get, we send them to a rheumatologist so that they could be started with disease modifying anti-rheumatoid drugs which help to control their disease activity. So on clinical pictures or on radiographic, we first have patient who have just positive factors like rheumatoid factor or anti-CCB but no asymptomatic disease. Second patient could have periarticular osteoporosis, means there is loss of bone around the joints. In third patient, there it could be joint destruction with along with bone loss, and in fourth stage we get the complete stiff joint. So in our specialty, the complete stiff joint we do replacement, most commonly in hip replacement and knee replacement. So these are, and moreover, since they are more osteoporotic because they haven't used their limbs for movement because of pain, because of swelling. So challenges are more in them as compared to normal osteoarthritis in which it is an age-related process and degeneration has occurred over a period of very long times. In rheumatoid arthritis, usually the disease progression is a little bit faster as compared to osteoarthritis.
What are the treatment options available till date for rheumatoid arthritis patient?
So, treatment options of rheumatoid arthritis depending on the stage in which the patient present, in early stage or late stage. In early stage, usually we start them on disease modifying anti-rheumatoid drugs, which is methotrexate is the first line drug management. If there is any contraindication to methotrexate, we switch on to leflunomide or sulfasalazine. If the patient respond to it, we can, there's nothing better like this. If it doesn't respond, because our aim is to remission of the disease, if it controls the disease activity, we will continue with it. If it increases, we have to add another biologicals like TNF alpha receptor inhibitors, IL-6 inhibitors, or monoclonal antibodies depending upon the disease severity. We have to switch over to that. And in late stages, I have all, like in burnt out diseases in which there is complete destruction of the joint or there is ankylosis of the joint, we need to replace that joint to provide mobility and function to that patient.
According to clinicians, what should be the changes in lifestyle for rheumatoid arthritis patients to prevent it and to improve the joint health?
So, in rheumatoid arthritis patient, apart from its pathophysiology, it is related to genetics. Like HLA-DB1 gene has been associated with it, and overall, some people say it is an epigenetics that there a change occurs in the gene over a period of time which can predispose them to RA. Other factors, environmental factors which are restricted are like smoking, tobacco use, especially obesity, asbestos, and silica. They have been seen to predispose the patient to rheumatoid arthritis. So, maintaining a healthy lifestyle with exercise can help to decrease the, or you can say increase the patient longevity with RA. We can't prevent that disease to occur in individual, but we can just, with this we can control the disease activity and help the individual live a better life.
Hence, we come to know what are the problems clinicians face to accurately diagnose the disease and counter the disease progression. Let's see how research is helping to answer these questions to narrow down the gap. Scientific research revolves around targeting the patients, their symptoms, and their disease progression with the development of holistic solutions involving therapeutic drug production or the development of diagnostic markers. CSIR, Institute of Genomics and Integrative Biology, work towards in-depth scientific analysis of different biological questions. In our lab, the work starts with the collection of blood sample, synovial fluid, and synovium of patients suffering from rheumatoid arthritis. The blood sample is also collected from healthy individuals, and the entire blood sample is processed to plasma. The plasma and synovial fluid are then stored in refrigerators maintained at -80 degrees Celsius to preserve the fluids. The tissue samples that are collected are processed down to grow the cells, in this case synovial fibroblast. We process these plasmas and cells to identify specific proteins that are found in these samples by running them through different proteomic analysis like SWAT or 2D gel processing, and identify the protein that is highly different from healthy persons to indicate the possible disease associated pattern. Finding important differential molecule is not an ending. Rather than it's the start of a long journey for biomarker or therapeutic targets. These proteins are validated for their expression in blood or other biological sample. And moreover, they should be unique to the particular disease to be used as a diagnostic marker. The scientific research also involves the testing of different therapeutic drugs that are either synthetically processed or taken from any plant extract. These compounds are tested first on a diseased animal model, and if the drug is found to alleviate the symptoms of disease in the animal model, then it is processed for clinical trials on humans in a phased manner and finally recommended by the clinician. Scientific research for decades have helped in understanding the pathophysiology of any disease and providing targets for diagnosis and treatment.
By knowing the details of disease progression, it will be easy for general population to identify the disease and also take steps to prevent it. So we suggest that people should keep eyes on such symptoms for them so that they can go for medical consultation as soon as possible to initiate the available therapy to reduce the disease progression.
We recommend that people should follow healthy lifestyle and maintain hygiene at individual level and their surrounding. Stay healthy.